how do I know whether I have PCOS?
I think that's one of the most common questions nowadays. As I was discussing with a few patients when they come to me, they come and tell me the diagnosis themselves. I think the information available nowadays on internet is so much that they self-diagnose. But I tell them, no, hold on. Let me tell you whether you have PCOD or PCOS. Because there's a huge difference between the two, and they fail to recognize that. I think PCOD, as it says, D is the disease, and S na syndrome. Obviously, syndrome, it has something little more than a normal disease would be. Generally, when PCOD, if I have to give a diagnosis, the patient should have either irregular cycles. Most commonly, they are on the higher BMI side. They do have lean PCOS also, but then PCOD, they do have on the higher side, higher BMI. Second, they have irregular cycles. They have a lot of fatigue, and along with that, thinning of hair. So that's most of the common things with scan findings. Of course, in ultrasound, we have to have a typical pattern of the ovary. If it is not there, then we don't call it PCOD. And the typical pattern of the ovary is identified in ultrasound, along with all these symptoms, is when they are labeled as PCOD. Syndrome comes when there are signs of insulin resistance or also with excessive androgen. So how do I know whether it's insulin resistance? One, either you're into the borderline diabetic range, where your metabolic syndrome is starting. That means your waist-hip ratio it's not okay. Second, when you have excessive facial hair, hirsutism, that tells you that your androgen or your testosterone hormones are high. I think those are into PCOS. So the difference between PCOD and PCOS is that when your systematic or metabolic aspect is involved, that's when you're more prone for type 2 diabetes, your heart risk, your cardiovascular risk increases. All that falls into the syndromic. So as a patient, what they need to know is you need lifestyle change. That's the first thing. Whether it's a disease or a syndrome, you need lifestyle change. If at all you're into a higher BMI range, then first check on your lifestyle. Because most of the patients these days, they come and tell me, I'm stressed. What do? I work 9 to 5 job. I come home. I have my own set of, they all have help or whatever. Even if they don't have help also, they are fine. They're 2-member family, but still they come and tell me they are stressed. Even or a 5th standard kid also comes and tells me, I'm so stressed because of exams. So stress nowadays is a huge concern. And also when they have irregular periods, they start junk with a lot of junk eating. And I think, so what is happening is, I have irregular periods, I'm moody, I want to eat more. Let me eat more. So let me eat more and soothe myself, because only then my mental health is going to be all right. So that's becoming a vicious cycle. And that cycle or the circle is not broken anywhere. That's what is happening nowadays. It's very important that we give a diagnosis of PCOS only when all the symptoms are met in the category. But the criteria has to be met before you even comment or utter the word as polycystic. The first thing they think is, I have too many cysts in my ovary. That's not how it is. It's just the pattern of the ovary. And the pattern of the ovary it's actually a misnomer. Polycystic ovarian syndrome or a disease is a misnomer. That doesn't mean that you have too many cysts in your ovary. They are follicles. I easily explain to one of the whenever patients come to me for irregular periods, I said, why doctor? Why am I not getting regular periods? So the easiest way I could probably put it across to patients is that when you probably say you have 40 students in a class, and in a month, there should be only one student who can become the leader of the class. There's no one student. Everyone wants to become the leader. So the leader is not elected by the end. So the 1 month just passed by without any leader. So that's very simple, very typical of a polycystic ovary. One of your egg doesn't get mature in that month. By 15th day, that egg should be matured. Until 30 days, 40 days, 50 days, they are still electing the leader. That means one of the egg is not selected at all. So that's why only when you have the egg selected and it becomes mature, it becomes a leader, when it does not fuse with the sperm, you're not going to have pregnancy, you're going to have periods. So this way the patients understand a lot better. I tell them, so what do you need to do for you to ovulate regularly? So the minute you ovulate, the egg releases, you're going to get periods within 2 weeks. The first thing I always believe is lifestyle. A lifestyle change. Let it be 11th grade or 12th grade. Even we did our 10th and 11th. Even we were also studying. It's not that we didn't study. But I feel nowadays the kids are already pushed. They're starting NEET coaching from 8th grade itself. I see few kids starting from 7th and 8th. So it's become a lot. The thing is that they have to study. So there's no physical activity at all. I tell parents, let them study, but the topic which they're going to study for 3 hours, if you allow them to send for some physical activity, they'll finish off in 1 hour. Ask them to play for half an hour or 1 hour. They can play badminton, they can play racket sports, swimming, anything. Study the same topic and they'll finish off in 1 hour, which they're supposed to do in 3 hours. And it actually clicks. Swimming helps a lot. The only thing is any physical activity is fine, but a kid needs physical activity. That's first. Genetics, of course, we can't go in and change their genetics, but I feel a lot to do with stress, sleeplessness, junk, lifestyle changes are the pointers, apart from thyroid. Thyroid, PCOS, and apart from all these insulin-resistant things, these are the common reasons why you could have irregular periods. Yeah.
In your practice, you keep mentioning stress repeatedly.
Yeah.
Okay. Is that a reason that you're mentioning it because it's getting very common, or is that one of the most important factors that will
No,
come?
it does. It actually makes a difference because your hormones get affected when you're stressed, when you don't sleep properly, when you're not having your food properly. For example, when you even overeat or undereat, both actually has an impact on your adipose cells, and that also has a direct impact on your estrogens, and that irregular makes your cycles irregular. It's extremely common. So stress does play a major role in your period cycle. I feel when you ask them, probably when they shift their houses or they have not slept for long or they had their exams going on, those periods get delayed. And once the kids' exams are over or anything, and then just gets regularized just like that without even medications. Stress does play a huge role in cycle regularity.
So getting a period delayed for a month, is it abnormal?
Actually not. Actually, let them not stress about it. I always tell them, if your cycles are regular, that's good. So regular cycles means every monthly one. So monthly once is probably 30 days. So have plus or minus 5 days. From 25 days to 35 days, it's considered regular. So when your periods, probably you're not getting your periods beyond 35, say for example a week or 10 days, or probably 45 days or 50 days, then you go meet a doctor. But that doesn't mean it's really abnormal. The first thing you need to check is what happened over the past 1 month or 2 months. If you feel that you have not been doing what you routinely do, or if you feel that this is not a routine thing, don't jump in and think that there's something abnormal. Don't get scared.
How is diet playing a role in your treatment of PCOS?
I think diet is one of the major things, apart from medicines. Whenever I give medicines for like hormones or anything, I tell them, as long as you're not going to fix your diet, I'm not going to give you medicines, because my medicine will work. Anything for that matter, I'm going to give medicine for your insulin resistance or anything. Whenever I give, it will work only when you are going to be on a diet. And the thing, when I say diet, they think that they should not eat. I think that to break that myth takes a lot of time. To have them come to the picture and say that diet is not eating. Diet is eating in the right quantity at the right time. So that makes a huge difference. Because nowadays when you tell them, doctor, we come back only by 9:30, 10, both of us are working. I feel so tired to cook and eat or have a dinner much earlier. I tell them, finish your dinner before 7. No, doctor, that's not possible. We come back and we see in Anna Nagar, we see food court, we stand there, we have biryani and come and what time do you have? 10, 10:30. No, that's not going to work. When you're planning a pregnancy, as much as you want it to be a healthy pregnancy, you need to prepare your body, as well as people think that it's only women. I definitely, again, for the men aspect, they have to prepare themselves also. Because
the quality of the sperm.
Quality of the sperm, it makes a huge difference. In miscarriages, how many of them think that miscarriage is only a woman thing? How many of them know that it's because it could also depend on the sperm. It could also depend on the quality of the sperm that a miscarriage can happen. Never always the woman's fault. I think it's extremely important that your diet, not just smoking and alcohol, your timing of food, the quantity, and what you eat. I tell them, don't make it simple. Just make sure that every meal you have one fruit, one vegetable. Just start with that. That's your first week goal. I give them 12 weeks goal. Literally, I tell them weekly once you incorporate one idea, then every idea you should add on to the next week. First week is incorporate one fruit and one vegetable. Second week, make sure that you have at least 2 to 3 liters of water. Include that fruit and water. Third week, you check. Because if I bombard them with too much information at the first time, they won't come back to me next time. They'll be like, doctor said I have to lose weight, I have to diet, I'll not eat anything. And finally, they'll lose 2 kgs. That will be only water loss. Then they'll come back gaining 3 more kgs than what they have lost earlier. So I'll tell them, start with small steps, tiny steps. as much as possible, incorporate those so that it becomes a lifestyle. So including a fruit and a vegetable specifically in your every meal makes a huge difference because that increases their fiber intake. Second, you increase their hydration. They increase their water intake. Third, fix their sleep. Fourth week, then gadget. So small things you tweak a little bit, actually they feel a lot better.
What is the most common dietary mistake that your PCOS patient would do?
Most common, right? Generally when they feel a lot moody or when they don't get periods, what happens is the progesterone completely, there's hardly not a good amount of progesterone in their body to let go of periods, but then they do have a lot of bloating and heaviness, mood swings and all. And the minute they have all that, they'll have to have something sweet. Something.
Sugar cravings.
No doctor. I have to eat something sweet. How can I sleep without having sweet? I'm having so much of mood swings. I'm shouting. I need to have something sweet. So either they junk eat. Easy thing is to order. We have everything available nowadays, and they just order food. It's either an ice cream or a donut or a pastry. I feel that's where they get into a cycle that it's only today, right? It's only today, right? So they don't even understand, even when they have menstrual cramps.